This is skill number 11, modified bed bath. This is where we bathe the face, one arm, hand, and underarm. I have gathered my equipment here. My equipment is a bath basin with warm water, a towel, 2 wash rags, and a clean gown, and soap. So I'm ready to begin my skill now. So I'm always going to do the same pre and post procedure actions. I'm going to knock, pause, and enter. Hi, Ms. Jones. My name is Ann, and I'm going to be performing a modified bed bath on you today. And I'm going to do my peanut butter sandwich. Remember, at the beginning and end of every skill. Peanut butter sandwich is provide privacy, ensure the bed is low and it is locked. Here's your call light, signal device S, and W, wash hands. So now I'm ready to begin the skill, giving a modified bed bath. Ms. Jones, will you please feel the water? Does it feel okay? All right, good. So now I'm going to apply my gloves. We always want to apply gloves before washing. It doesn't matter that we apply them exactly now, as long as we haven't started washing yet. That is the main thing about applying gloves. I'm going to remove her gown without uncovering her. Now remember, we will be doing this skill on a fellow student. So the student will have on clothes underneath their gown, of course, but we will be doing this on a fellow student. This gown goes directly into the linen container, the sold linen cart, and now we're ready to begin washing. So we're going to start with the face, and when we wash the eyes and face, we do not use soap. So I'm going to start with the eyes, and I'm going to wash the eye from inner to outer using a clean area of the washcloth for each stroke. Now I go ahead and have my students do it 3 times. The nurse evaluator would like to see you do it at least twice so she knows that you have changed the spot of your wash rag. So we've washed the eyes 3 times using a different area of the washcloth with each stroke. We've washed from inner aspect to outer aspect. That is the critical step. You have to do that first, and you have to do that correctly to pass this test. And then we wash the rest of her face. Nothing specific about how we wash the rest of her face. We still have not used soap. Okay, now I'm ready to dry her face. And we just dry it. There's nothing specific in the directions about how we dry her face. Now I'm going to place a towel underneath her arm, and I'm ready to wash her arm. Hopefully you can see with that sheet and everything there. I'm using my wet wash rag, but now I'm going to apply soap. I'm going to wash her fingers, including the fingernails. That is a new step here, but all you have to do is just kind of go at the fingernails a little bit and make sure that you are deliberate or you say out loud, I'm washing the fingers and fingernails. Saying the steps you're doing out loud is never a bad idea on this test, so the nurse evaluator is extra sure that you have remembered these steps in case she looks away for a minute. You never know. Now I'm going to use my rinse cloth. This one has no soap. I'm going to rinse as I wash the fingers, including the fingernails, the hand, the arm, and never forgetting the underarm. Okay, now I'm going to dry. I've got my towel here, so I can dry the underarm, the arm, and the hand. Okay, now I'm ready to put a clean gown on my patient. I will do this while keeping the client covered. And so I'll just go ahead and put the gown on over the sheet and then pull the sheet out from underneath. if we accidentally expose our resident, we would want to say, I would not have done that, which I just did. So I would not have exposed my client. I would have kept her covered. So now we're ready to do our next step, which is to get rid of our used linen into the linen cart. We're going to go over to the sink, empty, rinse, and dry our basin. Place it in the designated dirty supply area. Remove gloves without contaminating self after we're finished with the basin. Wash hands. Come back to our client. Make sure we do our post-procedure actions, which include remove privacy. Ensure the bed is low and it is locked. Make sure she has her signal device. And wash hands. And that concludes the modified bed bath